Hello, France is in the grip of a pandemic, with the medical sector increasingly angry about its current status. Welcome to the France 24 debate. I'm Mark Owen. We're here with my guests to examine the problems facing doctors and nurses and care workers across France, those who are in the front line fighting against the Covid-19 virus. Now, France has lost over 28,000 people to the coronavirus pandemic. The French medical profession, too, has lost its own. And indeed, I can tell you about one doctor that I know personally who treated my wife a while back, who has died because of COVID-19. It is a tragedy which is touching many families, many people across the whole country, including hospitals all over France. Now, every night until lockdown was eased on May the 11th, people were on their doorsteps, going as far outside as they could, from their balconies, from their windows, applauding and cheering health workers. So the health workers themselves would say they don't deserve this kind of heroic treatment. What they'd like, though, they all tend to say to a man and to a woman, is that they would like a decent living wage. And that's one of the issues we'll be exploring here. An average nurse, for instance, takes home less than 2,000 euros a month. And that puts French health workers among the lowest paid in the OECD countries, i.e. the lowest paid in the rich world. We're here to discuss the issues related to this. We have four guests. I'll introduce them in no real order of preference because they're all equally great. Jean-Jacques Zambrowski is a hospital physician and professor of public health management at Paris Descartes University. Jean-Jacques, thanks for being with us.
It's my pleasure.
Julien Taïb is chief of gastro-oncology at the Hôpital Georges Pompidou, just around the corner from our studios. He's also a member of the Collectif Inter-Hôpitaux. Julien, thanks for being with us.
Thank you for the invitation.
Zeynep Or is a health economist and writer and author of Is Two-Tier Healthcare the Future? Just one of your many books. Zeynep, thanks for being with us.
Thank you. Thank you for the invitation.
And last, and definitely not least, Paul Smith, Professor of French and Francophone Studies at the University of Nottingham there in the east of England. Paul, thanks for being with us.
My pleasure.
Before we let our guests loose, let's take a look at this report from Brian Quinn.
A system that has so far seen France through its worst public health crisis since the Second World War is one that was already strained even before the coronavirus hit. That, in spite of considerable fiscal outlay. France spends more than most European countries on healthcare. In 2017, that figure was nearly 260 billion euros, 11.3% of GDP, matched only by Germany, and well above the EU average of 9.9%. Critics argue that the 2003 introduction of so-called activity-based payment, in which medical procedures are assigned a monetary value, has actually incentivized more spending, not less. One place where money is being saved is labor, including that of nurses on the front lines of patient care. French nurses receive some of the lowest pay in the OECD group of developed nations. At around 1,500 euros per month after tax, their pay is below the national average wage. The country's nursing union says that in the 5 years after graduation, 1/3 of French nurses quit the profession. Another cost-cutting measure has been a reduction in overall hospital beds, part of a broad international trend aimed at increasing hospitals' efficiency. France now has some 85,000 fewer hospital beds than it did 2 decades ago, but so does Germany. With 6 beds per 1,000 residents, France is behind its German neighbors, but well ahead of Italy, Spain, and the UK. Despite cost-saving measures, France's hospital system remains some 30 billion euros in debt. As the government negotiates with health workers over a revamp of that system, it has so far agreed to transfer 13 billion euros of that debt to the state's own balance sheet.
Brian Quinn, our reporter, with that summary of the stories so far regarding the French healthcare system, pushed very much to the edge by this pandemic, which we're all living through right now. Let's bring in for comment, first of all, Jean-Jacques Zambrowski. Jean-Jacques, how alarmed are you at the current situation of the French healthcare system?
Decades. The COVID-19 crisis just emphasized and increased the visibility by everyone. But you know, doctors everywhere in the world, not only in France, are dedicated to their work and to their profession, as well as all the healthcare professionals. And they hardly complain. And when we go on strike, we just put a sticker on our costume and say we are on strike, but of course we keep working with the patients. So the governments, whichever they are, left or right or in the middle or nowhere, believe that they can put us to starvation, and now we are at the level of the bone. There is no more flesh. There have been cost reductions, closing beds, not increasing or even lowering some salaries, not recruiting enough people for decades now. The system was invented in the 60s, that is 50 or 60 years ago. And medicine, science, demographic has changed ever so much since then that the systems needs to be completely rebuilt from the basement. It's all upside down. The bureaucracy is enormous. The number of people who are paid there and who don't know what a patient is enormous. And I know that my friend and colleague Julien Taïeb, who is a wonderful physician with a wonderful team, with very severe patients, knows that better than anyone. We cannot produce the medicine we would like to provide to our patients. And this has been the case not only for the COVID-19, not even from the government before, but since, we were the first medical system, healthcare system in the world 30 or 40 years ago. And now we are about 25th or 26th in the graduation, which means we dramatically decreased the level, the quality, the safety, the comfort, and the pleasure of doing the most marvelous profession in the world.
Jean-Jacques, thank you very much indeed. You talked about Julien Taïeb. Let's bring Julien Taïeb in straight away to comment further about what Jean-Jacques was saying. Julien, how difficult has your job become?
I would say, first, I completely agree with a lot of things that Jean-Jacques have mentioned, but we have still a very good health system, and I think that the citizens in France are very confident in their health system and want to keep it. And what we have done with the Collectif Interhôpitaux since now 7 to 8 months is just to ring the bell, to ring the alarm, and to say that there is now a real problem because the nurses are in hospitals, and this is the first time we are facing such a phenomenon. We have sometimes the money to pay them, but they don't come because the job is too hard now, too many patients for one nurse, and the quality and the human relation is not here anymore. And all these people, as we do this kind of jobs, because there is a huge human involvement. And if we are only with numbers, a number of patients to treat, a number of patients to cover every day and to go fast and not to have time to discuss with the patients and their family, I think we lose the most important part of our job. And French people are very also asking for that, because they don't accept a doctor that is only a technician or a nurse that is only a technician. They want human contact and human care also. And I think this is a major point. We still have a very good system, but it's declining. So we have to do something. We face quite well the COVID pandemic, I would say, because except in the far east of France and one hospital in a Paris area, all the patients were treated well and no difficult choices were made. However, in a optimal country or efficient country, I would say that we should have been able to absorb this crisis without postponing many patients for non-urgent, because this care were non-urgent in March. They may be urgent today, and we are now going to face new patients coming too late with cancer, cardiovascular disease, and others that should have been treated earlier. So I think there is a lot to do, and we really hope that the Ségur launched by this government will change the thing, and that it will not be one more announcement with no real practical effects.
The Ségur de la Santé, just to explain to people watching who may not know what that means, it's an expression which has been coined from the fact that the health ministry is based in the Avenue de Ségur, and it's basically a kind of think tank, a debate around healthcare in France to work out where to go next. And it's promised by July there'll be some actual action. Top of the shop, though, Emmanuel Macron promising to up wages for health professionals, which is, if the president says that, you think it would happen. So maybe that's a reason to be cheerful for those people who are working so hard to make sure that people are basically kept healthy. And frankly, I don't think anybody would disagree with health workers getting more money. However, Why isn't it happening? Why has France fallen to this level? Why is a nurse's starting salary so alarmingly low, 1,500 euros a month? That certainly shocked me. Zeneb Orr, health economist and author of the book, Is Two-Tier Healthcare the Future? I think the title of your book perhaps gives us an idea as to where you might stand as to regarding what should happen next.
Yes, thank you. The question is actually, it's not only about money, and the issue that you talked about, the bad payment for healthcare workers, frontline workers, is an issue not only in France, almost all of the OECD countries. When you look at the range of salaries offered, social workers, nurses, people actually giving you the most important care have the least of the part of the salaries. So it's actually very much welcome. Actually, Macron's and the promise made by the government to increase the salaries of the nurses and other healthcare providers, including those working in nursing homes, is very much welcome. So about the problems that hospitals have been confronting in France and elsewhere, one issue that is often overlooked is that pressure in hospital and the working conditions in hospitals are very much determined also what's happening elsewhere in the healthcare system. When you look at what's happened in France, in March, when hospitals were flooded by patients in emergency rooms where couldn't accept any more patients, in ambulatory sector, the visits to specialists and generalists have fell down. 60% of the consultations with specialists, 30% with the generalists, despite the increase in teleconsultation rates. So we actually create pressure in one part of the system because we aren't using the resources in other part of the healthcare system. When you look at what's happening in the nursing homes, you understand half of the problem. So the point I'd like to make here is that sure, we need to invest in hospitals, sure, we need to improve the working condition in hospitals, but we can't only look at what's going on in hospitals without looking at what is happening elsewhere in the healthcare system to improve the overall healthcare system and reduce the pressure on hospital and improve the working conditions for those working on frontline in hospitals.
Indeed, and those, I think everybody would back what you're saying. I mean, that issue of hospitals being overwhelmed by the pandemic. I mean, certainly my own partner, my own wife, she caught COVID-19. I rang the emergency room. They said, "Stay at home. We can't cope. You know, if she can breathe, stay at home." It's an alarming thing to hear in a country such as France, that hospitals, even at that early stage, were overwhelmed. And that is something I think that is sinking in for a lot of people, and it led to a lot of goodwill for health professionals and all the applause and all the appreciation from ordinary people, which is a great, great thing. But as the medical professionals are saying, you know, they'd like to see some reward in their own pay packets to reflect that the country is serious about who they are and what they do, and the value of that work. Let's bring in Paul Smith, who's a professor at the University of Nottingham of French and Francophone Studies. Paul, thanks for being with us as ever. From your perspective, slightly more back from it and sort of as an observer in many ways, what do you make of this idea of having this big meeting, the Ségur de la Santé, as they call it, to discuss what happens, the things that the politicians say, and of course the expectations of the healthcare workers?
Well, I think that there's a certain amount of, there's that very famous song by Dalida, Parole, 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 and there's a very big risk here that this is another example of this. So I hope it isn't. The talk about raising wages is important, thinking about the working week, actually making the job, bringing the pleasure. Jean-Jacques talked about this great profession, and it's bringing back the pleasure of doing that job that's very important to health workers, not just in France, but in Britain, you know, everywhere. You know, this has really put pressure on, but it's kind of, it's really put the pressure on where there were already problems in our health systems. That's the first thing I would say. You know, it's the idea of getting around the table and trying to sort something out where there have been problems for 5 decades, revalorizing, giving a proper value to something that was already, you know, to some extent, the Gilets jaunes movement. Part of that was a complaint about the problems that ordinary French people we're finding in terms of getting healthcare, rural GPs, getting healthcare out in provincial France. So it's a great idea, and of course it's rhyming with what Macron was promising of doing whatever it cost to resolve the problems for the French health service, but it needs to actually deliver. I'm a little bit hesitant, not skeptical, but hesitant, because of course with Macron we've been here before, le grand débat national, and where's that? So it's a great idea, but it needs to deliver. So there is a political will for once to really deliver here, but and it's a very positive mood by the government, but let's see how it goes.
Let's take that on from Paul Smith talking about Dali, the parole, words, lip service, I suppose. Let's take a listen to Édouard Philippe, the Prime Minister of France, with what he had to say just a moment ago, of course, about the analysis of the health system that's going on, the conversation that has begun, and what the government is promising in no small way to the health professionals.
We want to be able to show our gratitude to our healthcare workers and to maintain their motivation for their calling. Our country's gratitude is enormous, and per the President, that will translate into compensation. I want to be clear that pay hikes will be significant, as will be the raising of our health budget target in the coming years.
Pay hikes will be significant. Well, he said it now, it's out in the open, so one would think that it has to happen. But as Paul Smith was saying earlier, it seems like we've been here before with le grand débat, with different discussions that have promised many things, and little seems to have materialized. Let's bring back in Jean-Jacques Zambrowski, hospital physician and professor of public health at Paris-Descartes. Jean-Jacques, you were talking about the pleasure of being a doctor, the pleasure of caring for people and doing that. Do you think what Édouard Philippe is saying could perhaps move back towards that route, help people start to feel that again? Or do you fear that this just might be parole, words?
No, I wish it is more. I wish it could really mean that the Prime Minister, the President, and the Minister of Health, who happens to be a hospital physician, he would see patients a year ago, just before he was named a minister, is to be taken for granted and for truth. I do hope that not only they will raise the salaries, but they will also look at the overview on the healthcare system, the relationship between the ambulatory care, the primary care by the private physician who really, like in the UK or other European countries, are in fact paid by the Social Security, by the government healthcare fund, and the hospital to have a closer relationship, to have the computerized data record of the patient communicating between the ambulatory sector and the hospital sector, which ought to be reserved for the most acute phase of the most severe disease, which is a normal healthcare system nowadays. Many things, X-rays, biology, even daily consultations can be performed easily and far better in the ambulatory system than having millions of people in the hospital, and especially in the emergency rooms of the hospitals. So the whole system has to be thought back, put on the table, and even restart with all the capital of the human qualities, the human knowledge, as everyone agreed since we've started this program. We have very good healthcare professionals, not only the doctors, but everyone pretty much dedicated to their work. We have a lot of good equipments that ought to be renewed and changed and multiplied. And we cannot stand that budgetary barriers who are decided by people who are ignorant until they have a patient in their own family, restrain us from producing the quality of care and the quality of medicine, including for the senior citizen in the retirement homes. It has to be rebuilt from scratch. And that's the purpose of this Ségur de la Santé, which is 300 professionals and people representing the patients' advocacy groups that are going to meet for 2.5 months. It will be a long discussion, a long negotiation. And I do hope, as we all do, that all the complaints we've had, all the letters, all the articles we've been writing, all of us, for months, will now be taken in consideration, and we will have finally this healthcare system that our population deserves.
Jean-Jacques, thank you very much indeed. It sounds like an incredibly grand affair, this Ségur de la Santé, with the 300 people taking part, as you say, over 2.5 months. And of course, people at the highest level in France are listening to what they are saying. So one would hope the message will land where it needs to land. Let's bring back in Julien Taïb, Chief of Gastro-Oncology at the Hôpital Georges Pompidou. Julien, with, I think the figure is a third of nurses quitting within 5 years of coming into the profession. How do you keep your team motivated? How do you keep people interested in a job where perhaps they feel very undervalued, which is wrong because they should be valued really highly?
Yeah, I think I agree first that there is not only the salaries and the payment of the employees, but clearly this is a major issue, because you cannot live in Paris when you have a child and no husband sometimes with 1,380 euro when you start to be a nurse. So there is a real issue here that has to be fixed, and you cannot pay your apartment or your food or your babysitting with applause. So now the government has to pay very quickly the additional hours performed by the nurses and the others, and has also to announce very quickly in the forthcoming weeks, not in 6 months, that there will be a substantial increase to just try to reset the salary of the lowest salary employees of the public hospital at the mean level at least of OECD, as you mentioned before. And I think this is really the emergency, because even if you can build a team that is really working well, even if you take care of your team and you see your nurses regularly and you try to make the job more easy every day, it will not be sufficient. There are really pragmatical things for daily life that they have to face that are too difficult. You cannot have a 2-hour transportation to come to your work on the morning time and 2 hours more in the evening time. It's too long, and there are many issues that have to be fixed. So we are trying in my institution also to motivate the governing boards of the institution to find also apartments and a lot of facilities for the nurses. And I hope this will come soon, but at the national level, the salaries remain a major issue, I would say.
Do you feel optimistic? Do you trust what the government's saying? Do you have any faith in the politicians? Julien.
What is interesting is that you mentioned at the beginning the OECD level of France, which is 29 or 28, depending on the calculation, out of 32, which is not normal because France is probably the 6th of the 7 power in the OECD. So these numbers were claimed by us initially 6 months ago, and now everybody is using them. So I think that little by little, the government understands that we cannot manage the public hospital like we are managing an industry or whatever, a company. It is something special, dedicated to health and patients, and it has to be like that. Sometimes it costs money, but when you invest money in that system, generally you save a lot of money. Imagine that during the and then we would have been able to take care of all the patients and not to have all this stress. The confinement should have been more selective, and probably that the economical consequence for the country should have been really less impressive than what we are going to see now. So I think this is the problem is that everybody is thinking short term today, and nobody sees, as said Jean-Jacques, until you don't have someone in your family that is sick, you don't see really the utility of spending so much money for the hospital.
Indeed, once it comes home to you, it's when you start to realize that things need to be done. And as Jean-Jacques, and as you just said as well, Julien, when people who are in charge of the budgets, perhaps within the health sector, aren't personally affected, perhaps they don't see the actual need to invest where you think investment should be happening. Certain people in certain countries think their health service is the very best. Of course, you just speak to someone from the UK, like me, like Paul Smith, we might sort of wave the flag for the National Health Service, the NHS, and say that's the best there could possibly be. People in France, of course, talk about the good things about this system. Having lived through both, there are great things about both. And then I've got friends in the United States, for instance, who do good jobs, work very hard, but they have to sort of look at kind of interesting ways to raise the money to pay for their kids' drugs, healthcare drugs, because the system is such over there that they don't have the necessary type of insurance to cover a certain thing. I'm not going to name the names because it would be embarrassing for them, but these stories, you read about them all the time. So I'm wondering about the reforms that need to happen. And Zeynep, I'm coming to you now, Zeynep, or as a health economist. What needs to happen? Is there a particular system that you think works best of all? Where would you be putting the money and getting that money to help the people and the profession as it needs?
Thank you, Mark. It's a great question. In terms of hospitals, actually, this is interesting. I think money matters. And I agree with Julian that it is important to pay people decently, especially people on the front line and doing very tough job dealing with patients. I'm talking about nursing, but I'm also talking about assistants and all those ungratifying works beyond doctors who are dealing with patients, and it's actually, we are paying them very badly. But as you know, as everywhere, in every other job, money is not the only motivation for people. Sure, I want a very good salary, but we're not motivated only by salary. It's important the meaning of your work, the feeling that you're doing something meaningful, the feeling that you control what you're doing, the meaning that you're working for the good and the quality of care and for patients, etc. I think why the situation in France feels much worse than anywhere else, despite the fact that when you look at the number, actually staffing numbers and bed numbers are much higher in France than in England. I think that with the activity-based payment, you talked about it, in the last 10 years, I think the sense of why you are working for has been lost. But here, the issue is not only money, the issue is also the management and health governance or hospital governance. I think having a management system where you only have budgets as a tool to direct your institutions, it is unproductive. I think people need to put value into what they are doing, and they have to agree on the way they are working and how they are working and improve their working conditions, not only by giving them more salary, but also giving them more power and encouraging teamwork. It is within hospitals. And I'm also going to come back to this coordination between hospital and primary care and social care, long-term care is extremely important. In terms of the measures proposed by the government, I think the Ségur Santé is good. It's a very good idea to put people together. But I think it is also very important to get the financial incentive rights, because you can come up with very good ideas, but if your ideas are against my personal financial benefit, I may be unwilling to push my limits, or I will push my limits to a certain point. In France, you know, the healthcare system budgets are separately calculated for hospital and for primary care. So we have a healthcare system with different budgets in competition, in a sense, with each other. Hospital budget is in competition with ambulatory care budgets. And the way healthcare providers, like healthcare professionals, paid in two different systems, put them into a competition. This is not what we want. I mean, as a patient who needs cancer care, of course you want to have the best care in the best hospital, in the best technology and medication, but you also need a chronic follow-up. You need to be people to talk each other, healthcare professionals to talk each other. You want to have a care and nurses who actually care about your home condition, and you actually prefer to have, if possible, many people prefer to have services at home than in hospital, and this is how the technologies are evolving, and there is where the progress is made. So when we talk about improving hospitals or improving healthcare systems, I think it's important to think about what is the place we want to give to hospital care in a healthcare system that we want as patients. You know what we talk about, patient-centered healthcare. So when you ask this question, examples are coming, and there are many examples in many countries, because you asked the question, what's the best example? It doesn't exist one best example, but you have good examples in several countries. We are actually publishing a report in the IRDES. It's coming out this month on different examples in several countries, including in the United Kingdom, where healthcare professionals working in hospitals come together with other healthcare professionals in primary care and social care and create teamwork for the best interest of the patient to provide harmonized continuous care, which is seamless for patient. It needs energy, it needs a different way of working. So it is not enough the willingness from healthcare professionals. You need to support these type of initiatives with good financial incentives. So just to finish, I think there are some good, important keywords in what is proposed by the government. One thing is quite revolutionary in French terms is to propose regional budgets, because France is a very centralized system and we manage everything from top down. So the fact to pronounce that we may need to give population-based budget to different regions is already quite revolutionary. I hope that this will go forward, but it's pronounced. And this is not symbolic, it is very important because it means that as a healthcare professional working in Paris or Grenoble or wherever you are, you can come together with other healthcare professionals and come up with a model which is suitable to your environment and your number of people around you, etc. So there is a hope there. So I think the numbers are important, but I think there are some key messages in this, what is pronounced by the government. It goes in the right direction.
Indeed,
so hopefully it's not going to be just
parole, as well, it all depends on how that money is spent, where that goes, what the priorities are. Paul Smith, can I bring you back in to talk in a broader sense about, and I think Zeynep was getting at this in what she was saying, that in some ways the health service you provide maybe sort of talks about the civilization of the country you are in. In fact, in some ways, it shows what France is about, if it's providing the right kind of healthcare. This is really something that I think perhaps strikes to the heart of being French.
Well, yes, a healthcare system tells you a great deal about the people, doesn't it? But I think what all our correspondents, all my colleagues have been talking about has been joining things up. And Zeynep's made the point there as well about the issue of regionalization, of a kind of subsidiarity in healthcare that's needed. But one of the other things that she's pointing towards is that, and this is the same in health systems right around the world, is that you have to have a health system. If you're going to change the system, if you're going to reform it, that reform has to be led by the people who are actually going to activate it rather than to be over managerialized. And that's something that we've tended to experience in the United Kingdom, whereas, healthcare workers are fabulous people. There's no debate about that. But the healthcare system here in the UK has really struggled. It's been much less, the word agile has been used, and I hesitate to use it because sometimes it means something rather unpleasant. But in France, it seems to me that the response to the crisis has been much more agile than the response here. But I think we might actually be at a turning point in French politics. Now, health has always been important. I'm not going to suggest that this is something new that's coming out. But, when you and I know, Mark, when we look at the British news every evening, I've for years and years, it's been the NHS bulletin. And I think that that's beginning to also change now in France, that there's this kind of awareness that it's been there before, but this has really pointed the finger at the problems that are now kind of breaking through, that many of us have known about, but it's really coming into the public consciousness now in France.
Paul Smith, thank you very much indeed. Come back to you, Jean-Jacques, on that issue of money. When someone like me, a humble journalist, hears that the French health system is 30 billion euros in debt, that seems to me incredibly shocking. What does it say to you?
Well, first of all, you must compare figures and figures. So the global gross domestic product of France is 2,200 billion euros. And the healthcare system there is about 200 billion euros per year. So the fact that it has been accumulating debt by borrowing money, when you cannot pay your bills at the end of the year, you have to borrow money. And fortunately, the French government and the France as a whole is credible enough to find bankers, people who will borrow money to whom or to which France can borrow money from. and we find loans at a very cheap price nowadays. So the question is not why are we in a deficit? The question is how to prevent us from digging the deficit again and again. How can we, with those 200 billion euros we spend for 67 million people living in France, how can we provide the best quality of care, the best, and the recipes are quite clear in my humble opinion. For example, we never have had a prevention policy as it is in some countries. We provide healthcare to everyone. Okay, that's very democratic. That's normal in the French philosophy. But how do we prevent some people among the providers or among the users of the system to cheat and to take more than what they ought to do? How can we make the best possible use of these 200 billion euros we spend annually, which is more than 3,000 euros per inhabitant? It's far enough to provide everyone living in this country, including illegal immigrants, who are entitled to get free medical care as they are entitled to get free education for their children in this country. And we can be quite proud of that. How can we, with this large amount of money, 3,000 euros, provide them with the healthcare support they need from their birth to their death, including the fact that since I was born, the life expectancy in France has increased by almost 20 years. And of course, the number of senior people with chronic, long-lasting disease and all the impairments that are happening when you are getting older is increasing. So the demographics has changed, the medicine has changed from prevention to diagnostic and to treatment. Oncology, the specialty of Julien Taïeb, has incredibly changed in the last couple of years. How can we adapt this system for which we spend a lot of collective money together? Our friends in the United States, when you're rich, you can have some of the best medicine in the world, but when you are not rich, then you cannot access that medicine. Fortunately in Europe, fortunately in France, you can access the best level of medicine, whoever you are. But how can we maintain this high level of medical care? And this creates the pleasure and the pride of being in the healthcare system I mentioned earlier. And we want our patients to be happy together with us, to be proud together with us, and be sure that as long as they live, they will be provided the best level of what progress, technicity, and research are providing to the healthcare system all over the world, because now the medicine is worldwide, and what is discovered here is to be used everywhere. So we don't want French citizens to be deprived of any innovation just for the sake of saving money.
Jean-Jacques, thank you very much indeed. Julien Taïeb, can I bring you in to comment directly on the back of that? In terms of the service you provided, Jean-Jacques, there's really painting a picture of the essential nature of what you're doing and how it's becoming more and more important. Clearly, you need more and more investment, but I imagine it's a question of how that money will be used.
Yeah, I want to say that, first of all, if you look at the UK, because there were comparisons done before, I think prevention is good. Region budget are good. But for example, to see an oncologist from the first symptom in the UK, you wait approximately 3 months as a median. In France, it's 3 weeks. To start chemotherapy is 4 weeks instead 4 months. So I would say that we don't want to move to such a long delay medicine for urgent cares. That still happen in many European countries, and that the level is still good. And I think that French people have seen what happened in other countries, like in the UK, but not only, in the south of Italy, the south of Spain, etc. So we want really to keep a good health system. I think that UK took conscience of that when Cameron was attacked at the European Parliament to improve the care, especially the cancer care, and it moved really good after that because investments were done. I think that it's always an equilibrium. We have to really face for the expenses and the incomes what is happening, what is really important to register the good medical in the good indication. And we are also have a lot of products that are cheaper and cheaper year after year. So the budget is increasing, but not so high. The problem in France is that the general cost of life in France increases of 4% per year, but since 10 years, the government gives us only 2% of increase per year. So you put more money every year in the health, this is true, but you finally, in a relative calculation, you increase the budget 2% every year. So it makes debt. That's why we are now with this debt. And I think, as Jean-Jacques said, that the system has to be revised. Is health a major concern for our governor or not? If it is the case, I don't think that a 2 billion more money every year is a big issue for a country like us.
Julien, thank you very much indeed. We're running out of time. Zeynep, final comment goes to you. And my apologies to Paul Smith.
Just I'm going to be very boring in my final comment, but unfortunately the resources are limited. So if you give more to health sector, you're cutting on something else. It could be education, whatever. We can make this decision, but if you give some more to hospital, you're taking from somewhere else. So giving more and more to hospital will not solve the problem. It's not just putting more money to hospital will solve the problem. You need, hospital care is expensive. That's why there is, on all of the healthcare system, there is a specific attention to reduce the hospitalizations because it's expensive, but also from patient's point of view, it's not the best place to be if you don't need to be. So I think it's important when you put more money in for investment in hospital to also center hospital on its own missions. When you look at in France, how the emergency care is used for things that will be cared by the primary care doctors normally, you see that misutilization of resources. So my final point is that it's not enough to put more money, we need to think more intelligently how we need to spend that money.
Zeynep, thank you very much indeed. Paul Smith, I got your message about avoiding something too close to the UK system. You mean basically avoiding it completely?
No, I just, we've been put under all kinds of pressures through managerialism. Let's, you have some good things going on in France. Hold on to the good bits.
Paul, thank you very much indeed. Paul Smith from University of Nottingham, thank you. Zeynep Orr from the health economist and writer, thank you for joining us. Thanks to Julien Taïeb of the Hôpital Georges Pompidou, just around the corner from our studios. Great to see you, sir. And thank you to Jean-Jacques Zambrowski, Professor of Public Health at Paris Descartes. Thank you all for joining us. Do stay safe. Thanks to you all for watching this program. Stay safe as well. You're watching France 24.
We are journalists, and normally you have to listen to us, but you have things to tell us too. Maybe you've experienced a dramatic event, or you've got something important to say. You want to make a difference. That is why we created The Observers. Now, the first step is very easy. You get in touch with our team. Send us your images, tell us what you've seen. And then it's our job to get your voice out there, on our site, on social networks, on your mobiles and tablets, and on TV, of course. You can appear in our weekly show via webcam. Or perhaps we'll come see you in person, where you live, in your country, your town, and we'll work together on a report for our investigative show, The Observers Direct. So you get the idea. This show is your show, your way to get your voice out to the world.
Liberté, égalité, actualité.
Pakistan's intellectual capital, Lahore, is known as the Pearl of Punjab. But its image has been tarnished by terrorist attacks. During the 2016 Easter celebrations, a suicide bomber killed 75 people, including several children. Fanatics targeted not just Christians, but the entire Western-oriented part of Lahore society. The city is finally embracing life again, with modern infrastructure, preserving its heritage, and a cultural renaissance. Discover Lahore's vibrant energy in this episode of Revisited on France 24 and France24.com.